8:16 now, time for this morning's Health Watch. And today, medicine goes mobile. New apps and websites are making it easier than ever to help you and health professionals keep track of everything from prescriptions to pregnancy. Our Dr. Jennifer Ashton is here this morning, along with Early Show contributor and CNET senior editor Natalie Del Conte, representing medicine, representing the tech side. Good morning, ladies.
Good morning.
So do you think, as a medical doctor, that these advances in technology are a good and helpful thing?
I think overall the answer is yes. They are advantageous to the layperson, to the average patient, because what they do, Maggie, is they really help compile information, medical data, and track it. And for anyone with a long-term or chronic illness, such as diabetes or high blood pressure, that information is key. How many people know when they go to their doctors, they sit down, the doctor will want to know what has happened since your last visit. And if that last visit was 3 months ago or 6 months ago or longer, it's very hard to know, well, what was my blood pressure over that period of time? So these things, the sum total of them, are very advantageous.
So they can be great if they complement but not replace.
Exactly. And they're not meant to diagnose. You know, Natalie and I were talking about that. They're never meant to substitute for the clinical judgment of a practicing healthcare professional and that interaction with an individual patient. They're not meant to use judgment. They're meant to track data.
All right, let's show some examples. What are some cool apps that you've found that might help people?
Well, one that I really like is Asthma MD. I actually am an asthma sufferer, and a lot of times I go to the doctor and the doctor says, well, how many attacks have you had? And I'm like, maybe 1 or 2 in the last week or so. This one lets me track my symptoms, the medication I'm taking, and what is actually triggering it, so that when you go to the doctor, you have a clear picture of what's happening.
What about for diabetes patients?
There's another one called iLet. It does something very similar.
iLet?
iLet.
How do you spell that?
It's spelled I-S-L-E-T.
Okay.
And you track your glucose and your insulin and how you're feeling in your exercise. Very similar.
Any other conditions you can think of where an app might be a good thing?
Well, high blood pressure, or in pregnancy, gestational diabetes, anything where numbers are at stake and you're following that over a long period of time, these programs can be fantastic. As Natalie was mentioning with asthma, a lot of asthmatics, when they're having an attack, will use something called a peak flow meter, and you get an actual number there. So if you have a peak flow meter at home and you're able to track your number, you can then tell your doctor over a period of 6 months, my average peak flow when I'm not having symptoms is X, my peak flow when I am having an attack is Y, and that information is very important.
You mentioned pregnancy. Natalie, is there anything you care to share with us or
our
viewers?
Yes, not only do I suffer from something called asthma, I suffer from something called pregnancy.
Oh, you don't suffer from
it. It's not a disease. I think I caught it from you somehow. But I've been using WebMD and Google Health to track all of my appointments, all of my sonograms, all of that information, and also babycenter.com.
I was going to ask if you've discovered Baby Center.
I have. You put in your due date, and every week it tells you what's happening. So I'm in week 25. I know it's the size of about 2 juice boxes.
I know, because they send you emails every week telling you where your baby is now, and they always compare the size to food.
I know.
Like a head of cabbage is what I got.
A melon or a mango. I know.
Okay.
But you know what? Whether you're
it feels like a bowling ball.
And it'll only get worse.
Welcome to the club.
Whether you're using it to track numbers or to prompt you with questions to then ask your doctor, overall, I think it's really helpful.
All
right,
ladies,
it makes you your own nurse, not your own doctor.
Good point. Natalie Del Conte, thank you so much. Good luck with the pregnancy. And
Thanks.
Jennifer Ashton.
A lot happens early on The Early Show, weekday mornings on CBS.